Hi, I'm Lauren. I'm going to be your nurse today.
Hi.
We're going to talk about disconnecting your own chemotherapy pump at home, flushing your port, and deaccessing your port at home. So I'm going to use this mannequin here to teach you how to do all of these things to help prevent you from coming to the clinic just to have to be deaccessed at the end of your chemotherapy infusion.
I'm really excited to be able to stay at home and not have to drive all the way into clinic just to get this done.
That's wonderful. I'm glad we can do this. We also have this teaching sheet for you to look at home. This outlines all the steps that we're going to review today. So it's there for you to look at in case you get a little nervous or anything at home, okay?
Yeah, thank you. And can somebody at home help me do this?
Yeah, that's a really good question. But we need to make sure that you and the person helping wash your hands thoroughly before you touch the chemotherapy pump or the port or any of the equipment. To wash your hands, you can use soap and water. Make sure that when you're washing your hands, you're scrubbing between the fingertips, your nail bed, so your fingernails. Make sure you're rubbing around everything with soap and water and wash it off. And then dry your hands with a clean paper towel. Or you can use a hand sanitizer to wash your hands.
Okay.
So here's some of the material that you'll need at home. You're going to need a chemotherapy bag, a sharps container. This is for the needle after you're done. A saline flush syringe, Band-Aid, gauze, an alcohol swab, chemotherapy gloves, and a chemotherapy spill kit just in case.
So I don't have any of these materials at home, so where do I get them?
So either me or the nurse that's treating you for the day will make sure that you have all of the materials before you leave the clinic, okay? The other thing that you want to make sure you do is make sure you have a clean work area at home. So before we started today, I wiped down the area with an antibacterial wipe and let it dry. At home, you can do that or clean the area with soap and water, make sure it's dry before you put all your materials out. So right now, I'm going to wash my hands and I'm going to put on my gloves and we'll work with the port and the pump. When you're at the clinic, your port will get accessed and you'll get hooked to your chemotherapy pump before you go home. At home, when the chemotherapy infusion is completed, you'll need to turn off your pump. You can take the pump out of the carrying case, and to turn it off, it's a two-step process. So you can see right here, there's a stop-start button. You're going to press that stop button, and the pump asks you if you want to stop the pump, you have to hit yes. Now the pump is stopped, you need to turn it off. On the side of the pump is the power button. You're going to hit the power button to turn it down, and it asks, do you want to power down? Again, you're going to hit yes. Now the pump is done. You want to make sure the clamps are closed. So there's a clamp on the tubing connected to the pump, and there's also a clamp on the tubing connected to your port. So you can close both of those clamps. To disconnect the pump from your port, you want to hold on to this blue cap, or sometimes you'll hear it called a clave. The blue cap needs to stay connected to your port itself. So hold the blue cap and then do a counterclockwise turn to disconnect the pump from your port. To make sure that no chemotherapy accidentally drips out or gets on your table or anything at home, you want to put the end of the tube into your chemotherapy bag. Again, that's just going to help keep everything clean and make sure no chemotherapy gets on anything.
Okay.
Now that the pump is disconnected from your port, we need to flush your port with a saline flush syringe. First, we need to make sure that the end of the blue cap is clean. This is really important to help prevent any infection. We're going to use an alcohol swab to clean the end of the blue cap. Scrubbing vigorously, think of squeezing a lemon to make lemonade. You want to make sure that the end of that clave is clean, and I like to do it for 10 seconds at least, okay? 4, 5, 6, 7, 8, 9, 10. Once that's clean, you need to make sure that nothing touches the end of the clave. If something were to touch the end of the clave, if you brushed against it with your hand or anything like that, you need to re-scrub it with a new alcohol swab. Okay? Next, I'm going to take a saline syringe, remove it from the packaging. With the saline syringe pointed upward and the plunger down below, I'm going to take off the white cap and gently push up on the plunger to push out any air bubbles.
So what happens if the saline comes out of the syringe while I'm doing that?
If a little saline comes out, that's fine.
Okay.
If a lot of the saline comes out, or if you touch the end of the saline and get it dirty, then you need to get a new saline syringe. Again, just like with the blue cap, I don't want anything to touch the top of that syringe. Holding the blue cap and your syringe firmly, you're going to connect them together and clockwise turn to connect them. Next, you need to unclamp your tubing so you can flush it. And this is very important. We do a pulsatile flush, or some people call it a push-pause flush. What you do is you push in about 1 milliliter of saline and then pause. Push, pause, push, pause. That's really important because it's going to push any chemotherapy or medicine that's still in the line into you. It's going to make sure that everything stays clean and working for the next time that you come. If it's hard to flush or push in the saline into your port tubing, stop. First thing, make sure that the clamp is open. If it's open and you're still feeling resistance or it's hard to flush, I want you to stop flushing and either call InfuSystem or your cancer care team. You might need to come in the clinic to have the port looked at. So you're going to continue the push-pause flush until you're done. And then when you're coming to the end of the syringe, continue to hold pressure on the plunger and clamp the line. Using a counterclockwise turn, you can remove the syringe. The syringe does not have a needle on it, so this can be thrown away in the regular trash. Do you have any other questions right now?
No, I think I understand you pretty well. I just definitely would need to practice this at home.
I think that's an excellent idea. After I finish the education, we'll reset the mannequin so you can practice and I can watch you.
Oh, great.
But next we're going to focus on deaccessing the port. You want to remove the dressing. They can be really sticky, so sometimes it's good to hold down on the needle as you're pulling up so you don't accidentally pull out the needle too fast. On our dressings, we also have these 2 steri strips that need to be pulled up as well. Again, I like to hold the needle down to make sure that I don't accidentally pull it out too soon.
Now, does it matter what hand I do this with?
For this part, it doesn't, but to remove the needle from the port, it's nice to use your dominant hand or your writing hand to help actually pull the needle out. For me, I write with my right hand, so I'm going to primarily use my right hand.
Okay.
Using my other hand, so my left hand, I'm going to hold down on these 2 clear wings to the chest. Using my right hand, I'm going to take these yellow wings and I'm going to pull straight out so the needle will come out of the port, and I'm going to listen for a little click. And the click is important to hear because that's a safety mechanism. That's going to help prevent you from accidentally getting poked with the needle again, okay? You might feel a little pressure as it comes out. Sometimes it's helpful to take a deep breath. I like to count to 3, so it comes out on 3. 1, 2, 3.
Now, will I bleed when I pull the needle out?
Good question. Not everyone bleeds, but occasionally you might, which is why we want to have gauze nearby. If you have a little bleeding at the puncture site, just hold some gauze and apply pressure to the area until it stops bleeding. Then you can take your Band-Aid and apply it over the puncture site, okay? I'm not going to do that on my friend here because I'm going to reset it for you to practice on next, okay?
Awesome.
Because this is a needle, you can't throw it away in the regular trash. It has to go in a sharps container. I'm going to take a break from our lesson for a moment to provide some important new information on returning the materials you'll be using. Now that your port has been flushed and deaccessed, we're going to talk about what to do with the chemotherapy pump. You'll want to make sure you wear your gloves and have your disconnect kit nearby. Place the CAD pump and all the tubing, cassette, and the carrying case onto a pad. Wrap up the equipment in the pad and place everything into the resealable yellow bag provided. Try to remove excess air from the bag and then seal the bag closed. Next, take this second yellow bag and use it to seal up the first yellow bag. You are double bagging the contents. It is very important for Dana-Farber to keep track of these pumps. If you are scheduled to be at the clinic in a week, you can return your double bagged equipment to your nurse in the infusion area. They will be able to accept the pump and process it. It's a good idea to set a reminder on your phone to remember to bring the pump into clinic. If you aren't scheduled to come back to clinic for a while, you'll need to mail the double-bagged equipment back to InfuSystem using a United States Postal Service box and label. You get this box and label from your clinic. It'll be given to you unassembled. When you're ready, put the box together and place the double-bagged equipment inside the box and close the lid. Use the blue stickers provided to seal the box. Place the sticker over the edge of the box like this. Now, back to our lesson. So you learned how to disconnect your pump, deaccess and flush your port. How are you feeling?
Good. It's definitely a lot of information, but thank you so much for demonstrating this to me, and I'm really, really glad that I can do this at home now.
I'm so happy we can do this too. Now I'd like to set up the mannequin so that you can practice.
Awesome.
Once you have packaged the pump, send the box back to InfuSystem via the United States Post Office. If you have any questions, call InfuSystem at this different number, 1-800-962-9656, extension 2240. They will help you send the pump back. Remember, if flushing is hard to push or you feel resistance, stop. Call InfuSystem at 1-800-315-3287 or call your cancer care team. Call your cancer care team if you have any of these signs or symptoms: fever of 100.4 degrees Fahrenheit or higher, bleeding, leaking, needle movement, redness, soreness, or swelling. Please speak with your cancer care team if you have any other concerns, and know that it is okay to ask for help.